You're listening to the Famvestor Podcast. If you're looking to raise your family with intention, gain financial independence, and live a life of true freedom, you're in the right place. Join us as we explore together how to create thriving families, because strong families are the cornerstone for a world at peace.
Hello and welcome back to another episode of the Famvestor Podcast. I am your host, Sunmarie Burns.
And I am your co-host, Sunny Burns.
And we have a really exciting episode today where we're going to delve into natural childbirth with Dr. Michelle Aristizabal, an obstetrician and gynecologist from New Jersey, who I am very familiar with. She's actually helped me bring our 2 children and soon to be 3 children into the world. And our journey has gone back about 5 years now since I've known her and first discovered her practice. And so we're going to be talking to her about her unique methods and forward thinking in terms of natural labor and childbirth for women in today's modern society. So to get us started, a little background about her. Dr. Aristizabal is an obstetrician and gynecologist in Montclair, New Jersey. She's delivered thousands of babies and has 2 children of her own. She runs her own private practice specializing in low intervention and unmedicated births, and she recently published a book on natural childbirth. So let's welcome Michelle to the show.
Thank you.
Thanks for being here.
So, Dr. A, how many babies have you brought into this world?
It's a common question, but I lost count a long time ago. But I'm estimating somewhere around 3,000.
3,000.
Wow.
Jeez, that's crazy.
We know the number for my individual practice, which is about 1,900 at the end of this year.
Okay, wow. And you actually, I believe I remember you saying like you had done like international studies or where you gave birth internationally too?
I didn't personally give birth internationally,
Sorry,
but I did help women give birth internationally. No, I was really lucky. When I was in my 3rd year of residency, I was able to do one of my rotations internationally. So I did that outside Arusha, Tanzania, and worked in a small hospital there. And it was an amazing experience and, opened my eyes to birth definitely a different way than I was training to do it.
Yeah, I'm sure medical practices in a country like Tanzania must be incredibly different than what we have here in America.
Mm-hmm. Yeah, you really learn hands-on clinical skills because you have nothing, ultrasound is limited, fetal monitoring is limited. So you have to get a good sense, just with your hands of how babies are positioned, what's going right, what's going wrong. And the decision to do a C-section is a much more serious decision there. So it's much more a decision of a last resort. So it teaches you to be a lot more creative if you can't just immediately go do a C-section.
Wow. What insight that brings. And so we're curious, why don't you tell us a little bit about your journey into obstetrics care? What inspired you, I guess we could start with, to become a doctor, an obstetrician? And what was your journey of education and entry into the field?
Well, I wanted to be a doctor since I was 6 years old.
Oh, wow.
I'm one of those.
Nice.
My aunt and uncle were visiting us when my aunt was about 25 weeks pregnant. And she went into premature labor while they were visiting.
Oh, wow.
She delivered my cousin at 1 pound, 11 ounces. And we happened to be living in Utah at that time where they had some of the best neonatology programs available. So they lived with us for 3 months while their baby was in NICU. And so that made this huge impression on me as a little kid of, I want to be like those doctors, I want to save babies. And so at 6 years old, I learned how to say neonatologist. And so when people would ask me what I want to be when I grow up, it would be, I want to be a neonatologist. And, they would bug eyes at me.
Most adults don't even know what that is.
Yep, a lot of adults don't know what that is. So I actually kept that through all of high school. I was able to be part of this shadowing program in high school called Medward Bound. And so I got to actually work in the NICU. And that was still my trajectory until I got into later college and early medical school and became exposed to women's health. I had done a trip to Tanzania actually earlier while I was in college, and worked in HIV prevention and really saw how much of a difference you can make when you work with women, and how you can change really the health outcomes for the whole family when you can kind of reach people at that stage. And then that was solidified when I was in medical school, as I became actually exposed to the different fields. And really by second, third year of medical school, I was pretty decided that obstetrics was where I was headed.
Wow. That's amazing to have a dream that you could carry so long in your life. You really were,
yes.
You knew what you wanted out of life, which is awesome.
Very focused.
Yeah.
So I'm kind of curious. So we want to talk a lot about like natural birth, and I guess I am curious like your journey kind of towards getting there. But for the listeners, who don't know about natural birth, can you just describe what that is and how it's different than, say, the majority of Americans who give birth?
Well, I think natural birth probably means something different to different women. For some women, natural birth just simply means a vaginal delivery. And for other women, natural birth means an unmedicated childbirth in a hospital. So giving birth without epidural or medicines for induction. And for other women, it means a completely uninterfered birth within their home or a birth center. So, I think people have different criteria for natural birth, but at least in the way I practice it, which is within the hospital, it's basically trying to find that middle ground between, medical intervention and the natural physiologic process of labor to keep women safe and have safe deliveries, but at the same time, not create problems with our medical technology.
Right. Yeah, I know when I was in my quest to find an obstetrician the first time I was pregnant, I really had no clue what I was getting into, and I just sort of figured I would go the routine route of just checking into the hospital and letting them handle the process for me. But through the process of being pregnant, I did a lot of research and thinking about the kind of birth I wanted to have. And I had this great fear or desire not to have a C-section. I really wanted to birth naturally, vaginally. And I wanted to do everything I could to ensure I'd have the best chance at that. And so I was looking for the right obstetrics team who could help support me in that journey. And it was really eye-opening to realize how hard it was to find someone who approached birthing from a less medicated model. And actually, it was my mom who found your practice for me. I had been searching for months or weeks, I guess, at that point, and not having too much luck. And then my mom, I think at midnight, she was doing a search, and she's like, I found this practice in Montclair. I think it'll be perfect for you.
Yeah, because I think we had settled on like a midwife. I'm like, okay, we're going to try this midwife route. But she was like, she wasn't really comfortable with it. She wanted a doctor.
I wanted to birth in a hospital should any, worst case scenario pan out. But I wanted also the chance at not being progressed towards a medical model too quickly if I had a stalled labor, something like that. So finding that balance is actually really tricky until we discovered you.
It's tricky. And I think you're in good company. A lot of women in the United States, I think, are going back and looking at natural birth. And because of that fear of, well, if I just sort of sign myself up for whatever is going to go down at the hospital, then I'm going to be that statistic that ends up in a C-section. And statistically, that rate's at about 32%, and it's been holding steady at that rate in the United States for many years. So I think people are going back and saying, well, what changed? Because we didn't used to have a third of our babies born by C-section. And so I think a lot of people are coming to, well, probably what changed is the amount of stuff that's coming into our labor. Yeah, there's other factors too. Women are a little older, there's more medical problems, babies are bigger, there's a lot of things on that list of C-sections, but certainly there's a growing number of people who suspect it's because of the amount of medical intervention in birth. We try to create that happy place, and unfortunately it's hard to find. And a lot of patients like yourself, they're not familiar with the idea of midwifery care as an alternative to obstetrics care, and they don't feel safe with that, because they certainly, there's a lot of people who don't feel safe giving birth at home, and they feel like they should have a doctor with them, and so it's more about re-educating healthcare providers that natural childbirth options are valid options, they make sense, they are safe, they're evidence-based, and to begin expanding choices for women.
Right, and I love how your practice incorporates all of that, as well as holistic ways to help women prepare for the best optimal
childbirth experience.
Yes.
Mommy brain.
Childbirthing experience. There we go. Mid-sentence there. So I wanted to delve into, I know that you recently actually published a book on this topic, and I picked it up recently and was very intrigued by the book and how it reaches out to practitioners in the field as well as pregnant women, and really explains the process from an evidence-based perspective. So would you like to share with us a little bit about the book that you recently wrote on natural childbirth?
Sure. When I started offering women the opportunity to have unmedicated births in my hospital in New Jersey, it wasn't something that was normal. Women didn't walk the halls. Women certainly weren't using hydrotherapy or other options besides an epidural. Over 90% of our patients at that hospital had epidurals. So there was a lot of resistance, and not coming from a bad place, but coming from real concern that these things weren't safe. And so, the nurses, residents, and other doctors, they really were concerned that what we were doing wasn't good medicine. So, every day when I'd be there trying to advocate for my patients that to help them get what they wanted in their birth plan, I would be there pulling medical literature of like, no, ambulation is fine. It's fine for a woman to get in the shower. It's fine for a woman to be up walking after her water broke. It's fine for her to eat in labor. And I would be kind of like pleading my case with the nurse. So after many years of that, I realized that there really wasn't a resource for either women or healthcare providers that actually said what evidence is there out there that actually shows that these are okay things, even though certainly midwives have been practicing that way forever, and they had as good, if not better, outcomes to obstetricians. So my goal became to get that into one place and have one resource that both healthcare providers and women could turn to, that wasn't necessarily trying to make the case that natural birth was better, which a lot of the natural childbirth textbooks are really on that bent. It's, let me convince you to have a natural birth. But really saying, no, these are just valid options that women can consider, and here's the why of it. Here's why healthcare providers might be reluctant to do it, and where's the middle ground for nurses, doctors, and women to work together to hopefully have lower intervention births that are satisfying for everybody.
Very interesting. Yeah, in the book, I know in the introduction you explain that when you initially started out in obstetrics care, you followed a more classical medical model until, I believe the book was saying, you had your second pregnancy and decided you yourself felt like you wanted something different.
Yeah, so I trained within a very medically aggressive kind of traditional obstetrics program, and when I became pregnant with my second child was in my 4th year of residency, and I had had a cesarean section with my first baby, and I really wanted a vaginal delivery, and I had seen sort of the typical scenarios play out. It was even challenging to find a doctor who would, quote unquote, let me have a vaginal delivery after I'd had a C-section. And so I just started researching ways that I could make that happen or increase my chances. And I kind of joked that I wanted to do something like on the sly because, I couldn't let people in my program and my hospital know that I was trying to do this natural hokey thing. So that's how I discovered actually hypnobirthing as a method. And, which really is, it's just teaching meditation as a method to deal with childbirth discomfort. And it made a lot of sense to me, just even from a physiologic standpoint. If, you can reduce tension in a woman's body, if you can decrease the fear and anxiety around the childbirth process, of course it's going to go better. So as I, went through learning about that, I became intrigued about it. And then when women came to me wanting their own natural births, then I was all on board for different ways to help support them better. And so, from there, I really went on to learn as much as I could about supporting women in that way.
I think it's fantastic how your journey into natural childbirth is really a personal journey for yourself, in wanting something different for your own birthing experience, and then how you've taken the knowledge that you gained through all of your research to help so many women who are looking for something similar, and you kind of streamlined a path for them or given them a course they can take. I took hypnobirthing. For those listeners who aren't familiar with what it is, it's one of, I think, several methods you can approach to childbirthing, and it's as you mentioned, Dr. A, it's about mental training and relaxation, how to calm your mind, how to meditate through the surges in labor, and handle your breathing so that your body can be as relaxed and calm as possible. I'm sure there's other methods as well, but I practiced this one through the suggestion in your practice and found it really helpful with both of my kids too. So
yes, some of the other methods, I mean, they all are kind of becoming fairly the same in terms of their approach. I think, any major childbirth education method that you look into is going to have kind of some of those key components. So, things like Bradley method, Lamaze, they're all realizing that benefit of, not that like old fashioned, like hee ho ho, find your focal point type of labor, much more mom centered, teaching mothers ways to breathe properly, to help their body work with the contractions rather than resist them. I think that's the key.
So just to kind of dig into this a little more, why would someone, what would be kind of the benefits of going the natural birthing route rather than maybe the more traditional of just getting an epidural and having a baby that way? Could you describe some benefits that could happen of doing natural birthing?
Well, I think it's definitely something that's argued about in terms of how truly beneficial it is. But I think a lot of the reasons that women want a natural birth is, one, just to have bodily autonomy through the process. So, a lot of women don't realize that when they choose to have one medicine, often that kind of snowballs into a lot of different things that maybe they didn't think about when they made that decision. So,
like
for
what
example,
exactly? Like choosing the epidural,
yeah, so
what would
if
that?
they have an epidural, then very often mothers will need medication to keep their labor going with that epidural. So if someone has an epidural, we see higher rates of, for example, Pitocin, which is a medicine that makes for stronger, more consistent contractions, because the epidural can kind of slow down the frequency and strength of contractions. If a mother has an epidural, she's more likely to need continuous monitoring of her baby as opposed to intermittent monitoring of her baby, because we see more frequent like heart rate changes for mothers who have epidurals. Mothers are more likely to need a Foley catheter because they can't empty their bladder. They're more likely to need IV fluids. So there's it's much more than just a single intervention. Oftentimes they come together kind of as a group. So I think that's one reason that women choose not to have an epidural, is just to avoid that kind of snowballing of interventions where they wanted some pain relief, but they ended up with all this other stuff that they didn't want. The other kind of $1 million question, and certainly the one that's most debated, is just, does it do all of those snowballing of interventions? Do they increase a woman's chance of having a C-section? The evidence is pretty consistently says that there's not a huge difference between moms who get epidurals and those that don't, but those studies are really challenging to do because, one, it's really hard to actually put women into proper groups to actually look at this, because you can't really tell a woman you have to be in this group and you can't have an epidural, or or vice versa. You wanted an epidural but you can't have one. So it's really hard to properly separate women to actually study this. And then there's so many different factors that come into the labor that it's hard to figure out what was the epidural, what was not. So that's why it's a challenge to study. But probably the best way that we have to compare that is looking at different types of providers' rates of epidurals and how that correlates with C-section. And definitely providers who have less patients who use epidurals have lower rates of C-section. So, we see that correlation, which just tells us that epidural may be in and of itself a marker of just more intervention in general, including cesarean, rather than like a thing in and of itself. So, so I think that's, some of the benefit of going that route.
I remember reading some fact or something about like Japan having like 8% C-section rates or something like that. I don't know if it's true, maybe and like just the different culture differences and different practices that could cause something like that.
We definitely see incredibly different rates of C-section between countries. We see incredibly different rates even within different states in our own country, and even between different hospitals within a single state. So we know that, given that we can have those vastly disparate rates, that it's something more than just a culture thing. It's something more than, this type of woman, or, this way medicine's being practiced. It's something to do with what's happening during the birth process that is producing those different rates.
Right.
Natural, humans have been doing it for centuries and we'll be fine, but wasn't the case, didn't seem like it. And I don't know if you can just go into a little more about, natural birthing and how that might promote, the golden hour and those kind of practices.
So, I think the practices that kind of go hand in hand with a unmedicated childbirth choice are basically all of those things that are really being respectful of what we call like a physiologic birth process and care of a newborn child, which would certainly be trying to minimize separation between mom and baby, and that's both for just baby's well-being and mom's well-being, and promotion of breastfeeding, because we know that the less we disturb mom and baby in those crucial first hours after birth, the more likely it is that the mom and baby have successful breastfeeding in that initial time period. And establishment of successful breastfeeding in that initial 1 to 2 hours after birth, or the golden hour, is highly predictive of successful breastfeeding later on down the line. So there does seem to be something important, some sort of like imprinting that's going on in those first few moments. Proponents of natural birth are really about holding space for all of the components that help not just facilitate successful birthing, but successful mothering of the new infant.
Yeah, I know in your practice, it's so much more than just a doctor and patient relationship that ends at the point of completion when you have a birth. In your practice, you've incorporated prenatal yoga for moms to kind of prepare their bodies for most optimal birth. You have childbirthing and breastfeeding education classes in-house in your office. You have doula services, and I know that your mom works with you closely in that area within your practice to support moms who are looking towards a natural birth. And I think that it's really quite an exciting model that really views the labor experience more whole person and more long term, not just purely focused on the event of having your baby, but how are you going to manage your body before having the baby? How are you going to manage after having the baby? And I feel like that's really groundbreaking. There aren't a lot of offices I know of that provide such a whole person system of care. So how did you decide to start incorporating all of that into your practice?
And what is a doula?
Yes.
I'll get to that. Yeah, so it was just through trial and error. As I was a new doctor in practice, and I had an increasing number of women kind of seeking me out for these types of births, I realized that just sort of writing the right orders during labor and being willing to work with them in that way on labor and delivery wasn't enough. Like there weren't enough women that were achieving their goals because what I really discovered was that the foundation for that labor and delivery experience happened during the pregnancy. So, I often with patients will use the marathon analogy that labor and delivery is a marathon, and any one of us could wake up and decide to run a marathon tomorrow, but if we hadn't trained for it, we wouldn't be likely to finish it. And the same applies to natural birth. Anyone can have a natural birth. Otherwise, we wouldn't all be here today. But when we have other options available, if we haven't prepared well for it, it's not likely to happen.
Right.
So that's, we started off just offering childbirth education because we found that when we just sort of sent the patients out to sort of find it, they weren't necessarily getting consistent education. There was lots of varied qualities of education, and some people might just go to a class for 2 hours on a Saturday. Some people might do a whole 12 class session of Bradley, and we saw lots of variation in terms of how they did. So we began, offering the childbirth education that was, we felt most grounded in the evidence. And then from there, we began offering other services such as the breastfeeding education, as we saw moms struggle to breastfeed, and not just have it happen like that,
Right.
as I think so many people would imagine it. We realized that there was a need for a lot more support. So we started off with breastfeeding education before the baby was born, and then realized that people even needed more support. And so we started doing lactation support in the office afterwards and home visits with our lactation counselor. And then also, yes, incorporating other things like the yoga, the exercise, because again, physical conditioning is just as important as the mental conditioning for labor. Because literally it is comparable to a marathon. It literally burns a similar amount of calories. So if women aren't physically prepared for that, again, they're not likely to be successful. Going to the doula question, doulas are also something that we provided in our practice. Doulas are not a medical provider. They are individuals who have specialized training in supporting women through the birth process. And so what doula means is really just a servant for the woman during her labor. And so she provides hands-on support through every single contraction. She, can help guide women to different positioning, different breathing techniques, different massage techniques during her labor to just help her cope and help her get through. And the science backing doula use is very strong. We see women who use doula have significantly lower rates of epidural, significantly lower rates of cesarean, and much higher satisfaction with their birth process. So the hardship for women is being able to afford a doula. So because doulas aren't covered by insurance, that's often the limiting factor for a lot of women in choosing whether or not to have a doula. So part of the reason we began offering them through our practice was just to make it more affordable for women to have a doula. So the practice was able to compensate some of the cost by employing the doulas ourselves, and then could allow more women to have a doula.
Now, where did doulas originate from? Is it a new concept? Is it something that's been around for centuries? I'm curious to know.
In the midwifery model of care, the midwifery model of care very much supported continuous hands-on support of a woman during labor, and that was viewed as a very crucial part of the labor and delivery process. However, as midwifery has changed and evolved from, just one midwife sitting with you at your house, helping you have your baby, to midwives running practices that are very similar to obstetricians' practices from the standpoint of, busy, lots of women to care for, lots of women to deliver. Their ability to be that kind of continuous hands-on support has become less. So I think doulas, while I'm sure there's always been women who serve that support role, and, I think back 100 years ago, it was probably family members, mothers, right, cousins, aunts, who served that continuous support. But nowadays, this profession has grown. I don't remember exactly when the first certification program for doulas came to be, but, it's been within the last 20 years.
I know with my first two, I did make use of doula care through your practice, and I did find it very invaluable in just getting me through what I was going through, giving me the confidence I needed, and also the extra comfort measures when I wasn't sure what to do, and there was someone there who was knowledgeable and could help me. So it was definitely a huge plus for me with our first two. And
yeah, especially that first one we had a pretty we had a nurse who was pretty not
grumpy,
so accommodating. She's like, "Why are you up? Stop standing up!" And
Yes.
the doula just kind of helped say, "No, it's okay. We're just gonna walk up down the halls,
right,
just to help make sure everything's progressing." And
my labor stalled a bit, and I believe it was directly correlated to my stress with the nurse I had, because every time she came in the room, I was like, oh.
Right. Because originally she was like, "Go home, you're too calm. You should be like screaming right now and in total pain. So just go home. You're going to waste your doctor's time. She's going to come all the way here, and she's going to be here for 12 hours. And you're not even close to giving birth. And then you gave birth like 4 hours later or something."
Right.
Yeah.
And
she guilt tripped at me for having my doula there. She's like, "Just think, you're taking her away from her life so that she can be here with you, and you don't even need her right now."
Yeah.
But anyway, she was a huge support to me, just in knowing what I can do to help myself find comfort in a not so comfortable time in your life when you're in the middle of labor. So it was very invaluable for me, for sure.
Yeah, and I always tell patients, it's always, couples, I think it's sometimes just very helpful to have that third person in the room who sort of walked this path before.
Right.
And so especially for a first baby,
right,
you're there together trying to bring this most precious little person into the world. And no matter how well prepared you are for that, there's a huge amount of fear and anxiety that comes into it. And so just having somebody there to say, "Yeah, that's normal," or, "Oh, you're struggling, let's try this. Let's do that." Doulas are worth their weight in gold, I always tell patients.
Right.
Incredibly, incredibly helpful. And they do smooth the way if you do encounter somebody in the hospital environment which you don't have control over, who maybe isn't a comforting source for you, who isn't encouraging, who isn't helping your process. They can kind of dilute that effect on your labor.
Right. Yeah. No matter how much education I think you do before giving birth, for a first-time parent, both both the man and the woman, it's a new experience, and you're going into the unknown. So, it really does help, as you said, to have someone who's gone that path before. And on that note, I also wanted to mention, you provide all these educational resources to the women who come into your practice. And I think what really struck me was how in America, I feel a lot has been lost in terms of being in tune with and in touch with these kind of natural processes. We aren't necessarily there with our mothers and our cousins and our sisters when they're giving birth. It's a very hush-hush topic. You don't really learn a whole lot about it as a young woman. And then when it comes your time...
conversation.
Sorry, what?
It's not considered polite conversation.
Right. Yes. So it's very much avoided. And same with breastfeeding topics, and even newborn care. But just in general, there's a lot of ignorance around the natural process of labor and delivery and postpartum care for a woman. So I feel like having all these educational resources are so important for women. You provide them in your practice, but even for our listeners who are in other parts of the country, just finding that knowledge, really reading into it, looking up things, and also asking the people that you know in your life who have gone through this before you, your own mothers, or your siblings or neighbors or friends. I feel like it's so important to just open that channel of conversation, because through that knowledge you gain confidence, and then you can disconnect somewhat from the fear of the unknown, of what you're getting into, which, as you mentioned earlier, it's that fear that triggers a lot of the pains and the concerns that may lead to other interventions during labor.
Right, you see all those videos. Like, I feel like most of the people's experience with birthing is just watching movies where these ladies are screaming their heads off, and
Absolutely.
Yeah, that's pretty
Yeah,
scary.
it's no wonder everybody's terrified.
Right. Or they're watching all these medical shows on TV where they always show like the worst case scenarios.
Oh,
it's
yeah.
like, oh.
They build up the drama.
Yeah.
No, my life became incredibly difficult at the time. The Call the Midwife episode came out with the preeclamptic mother having a seizure, and then everyone for a good year and a half was convinced they were preeclamptic.
Oh no. My mom loves that show. She's like, you should watch it. I'm like, I will not watch it during my childbearing years.
But not during the childbearing years. Yeah.
After I'm done.
But no, I mean, you absolutely are correct that women don't have direct experiences with these things, and that's part of what's increasing anxiety levels about childbirth. And then, for whatever reason, sometimes mothers and grandmothers, sort of hype up their own birth stories too, and people enjoy sort of scaring women about their upcoming childbirth.
It's like a badge of courage. What
yes,
I went
exactly.
through.
It's like, yes, their birth story, which just becomes more dramatic each time in the telling. So yeah, I think education and having dialogue with different people and a number of people can really help women understand what they're going to go through and feel better prepared for it.
So if listeners kind of like this idea of natural birthing and everything that we've been talking about, but they don't have a practice like yours, and I know your practice is just super busy already, and where are some places they can turn to? I know you have the book. What other resources do you recommend for people if they want to learn more about this?
Well, I think we definitely are fortunate in that we live in the age of social media, and there's lots of resources that women can use to find more like-minded providers and, really, find out if their hospital, if their doctor, if their midwife is going to be supportive of what they want for their labor and delivery. Some organizations that patients can turn to are things like the International Cesarean Awareness Network. They have a good list of of natural friendly providers. Some of the mom, what is the word that I'm looking for? The pregnancy brain translates.
You're catching.
So some of the chat rooms. So things like, motherhood.com, a lot of those are good resources where women can say, hey, is this will this hospital be supportive? Will this practice be supportive of me? And can kind of get the lowdown. And I think the big thing is just women should feel totally comfortable and able to sit down with their doctor or midwife and say, hey, this is what I want for my labor. How do you feel about that? And if they're not getting a supportive response, then they should feel free to go and find another provider who's that they're not going to be fighting with during their labor and delivery.
Right. That's so important. So those resources are out there for the women who are looking for them. Just, you got to search for it. In technology age today, there's just such an abundance of information out there. So I'm curious. I know that your practice, I know firsthand, is very popular and very busy. And you being a mom yourself, how do you find balance in your life between the doctor's life, which I know can be extremely unpredictable, especially in obstetrics care? A mom could go into labor anytime, and just balancing that with raising your own family.
I think that I would be lying if I said I had figured that out. And most of my patients who I talk to who are moms who are trying to balance work and motherhood, I don't think anybody's having an easy time. And so I almost feel like it's disingenuous to say that there's a way to have that balance. I think, but I do think that there's a way that we can at least start putting small boundaries in our life of, okay, this is where I maybe can set down my mom hat for a moment and pick up my work hat. And these are the situations where I'm not willing to set down my mom hat. And so, at least in my practice, I always tell my patients, like, there are days I don't deliver babies, and I have those carved out. I have those protected days. And then I also do a lot less work in the office than I think a lot of other general OBGYNs do, because I do try to be there for all of my patients, as many as I possibly can be there for. So I don't do as much gynecology, for example. So, I only do 2.5 days a week in the office, whereas most OBGYNs are doing, 4.5 days a week in the office. So that's where kind of I draw my line, I draw my boundary. And then I also have a huge amount of help. So I definitely outsource a lot of what would be, typical domestic responsibilities. There was a good 3 years where I did not walk in a grocery store. So it's I think we're all struggling to get it all done and give everyone what they need. But I do think that very profound analogy of you have to put the oxygen mask on your own face before you can help anyone else on a plane. It applies to life. So if you're not finding a way to take care of yourself, you're not going to not going to be a good doctor, not going to be a good mom. So, as best I can, and it's something I'm still figuring out.
What sort of things do you like to do to kind of help yourself get into that more relaxed space? Because I'm sure it's a very high stress, high demand profession that you're in, and to just be able to come home and turn that off must be very difficult. I'm curious what you found that helps you in that transition.
It's very hard. I'm responsible for a lot of people, and I take that very seriously. No, I walk in the woods. Literally. I walk in the woods. At least once or twice a week, I'll just, go off by myself, listen to music, and go hike. That's, kind of my quiet time. If I don't get that, then I feel it. And then I write I do a lot of writing as well. So, that kind of takes your brain out of, the day-to-day craziness, and
Nice.
you're able to enter a different world. So.
Yeah, I mean, you bring up a good point. I think sometimes it's important to just physically remove yourself from your normal day-to-day environment in order to just sort of reconnect and reboot. Mm-hmm. And going out into nature is one of the best ways to do it. We do it quite frequently ourselves as well. Mm-hmm. Go on hikes with the kids when we can, and just getting out and getting fresh air seems to bring new perspective. And
it does. I'll prescribe it sometimes. You need to go walk in the woods.
It's a valid prescription. Yes.
Yes.
Get clean air.
Absolutely.
Hear the rustle of the leaves.
Yes.
So we know you've written this nonfiction book. Have you written any fiction books?
I'm working on one.
Oh. Yes. Can you give us a little preview?
Totally not anything related to what I do. But
no fiction births in that story?
No, don't think so. Sometimes I'll have a little idea of, and then I try and push it away because need space without birth. No, it's a fantasy novel. Novel of, self-discovery and magic and all the things that, are too often missing in our day-to-day life.
Very cool. Very cool. So, Dr. A, it's been a fantastic talking with you. What do you hope that people kind of get inspired about, listening in on this conversation? What do you hope that resonates with them?
Well, I just would hope that women know that they have options, and that if there's ever a thing that should be yours, it is this really magical, special moment where you grow your family and meet this little person who is the continuation of you. And so, I would hope that women feel empowered to take ownership of that process and know that they can, and that there are people out there that will support them in that.
Well, thank you, Dr. A. If anyone is interested in reaching out to you, how can they get a hold of you?
They can reach us through at www.wombkeepers.com is my practice website. And then they can also reach me through the website for the book, www.naturallabor.com and naturallaborandbirth.com. I'm plugging my own incorrect website.
So that's www.naturallaborandbirth.com. There we go. Okay.
Yes.
Great. Well, thank you so much for giving us your time and your thoughts and perspectives. I feel like this is a valuable conversation that will benefit many women and hopefully give them the confidence to pursue the birth that they are striving for. So I appreciate you giving us this time and for this enlightening conversation.
Yeah, thanks for being here.
Thank you so much.
Thank you so much.